Stop overlooking your knees. The golden drink, daily walking, and true joint relief. Experiencing joint pain doesn't mean you're falling apart or facing permanent, unchangeable inflammation. Often, this discomfort is influenced by lifestyle factors like joint stress, limited movement, poor diet, and irritation in surrounding tissues. This indicates that you can adopt supportive habits starting today to reduce pain and enhance joint function in the long run. This isn't magic, it's about structure. We'll explore 3 core elements. 1. A daily anti-inflammatory drink known as the golden drink. 2. Intelligent movement, particularly walking. 3. Dietary habits that lessen stress on your joints. Additionally, there's one optional supplement under study for joint pain. Let's begin with the drink. The golden drink. Recipe. 1/2 cup water, 1/2 cup coconut milk, 1 teaspoon ground turmeric, a pinch of black pepper, 1 tablespoon collagen, optional, a hint of stevia for sweetness. Blend the ingredients together. You can enjoy it warm or cold once a day if you prefer. Why is this combination effective? Turmeric contains curcumin, a bioactive component researched for knee osteoarthritis. Certain trials suggest that curcumin extract may alleviate knee pain and boost joint function, sometimes producing pain relief comparable to common anti-inflammatory medications, like ibuprofen, and with fewer digestive side effects for some individuals. This includes direct comparisons involving people with knee osteoarthritis. However, curcumin alone has poor absorption. That's where black pepper comes into play. Black pepper has piperine, which can significantly enhance curcumin's bioavailability. Research indicates this combination can lead to up to a 20-fold to 2,000% increase in curcumin absorption into the bloodstream. Thus, black pepper contributes not just flavor, but aids in your body's ability to utilize what you're consuming. Important safety note. Curcumin and piperine may interact with specific medications, particularly blood thinners. They could present problems for individuals with gallbladder issues or bile duct obstructions. Pregnant individuals should also exercise caution regarding high doses of supplements. If you're taking medication or have a chronic condition, consult a qualified healthcare professional before introducing high doses of turmeric or piperine into your routine. Many joint support drinks incorporate collagen powder. Collagen supplies essential amino acids your body requires for connective tissues like cartilage and ligaments. It's a common element in joint health practices. The evidence regarding collagen is mixed, but it's typically deemed low risk for most adults without specific contraindications. If you happen to be allergic to a certain source, for example, marine collagen, clearly, you should avoid that source. Now let's turn to another plant aid people inquire about: Boswellia. Boswellia, often called Boswellia serrata, or Indian frankincense, is a resin extract traditionally utilized for inflammation. Systematic reviews and analyses of clinical trials indicate that Boswellia extracts may alleviate pain, stiffness, and enhance function for those with osteoarthritis compared to placebo. In some studies, the effects are notably significant after weeks of usage. In simple terms, for some, it's not miraculous, yet it's also not snake oil. It appears to be a potential supportive addition. However, Boswellia is still a supplement. Quality may differ among brands, and it can interact with medications, including blood thinners and certain anti-inflammatory drugs. It is not automatically safe during pregnancy. Consider adding Boswellia under medical guidance, particularly if you have underlying health conditions or regularly take medications. Thus, view turmeric plus pepper and possibly Boswellia not as substitutes for medical care, but as tools that may help reduce daily pain, provided they are used responsibly and with approval. The next pillar, movement. Joints dislike inactivity. When you refrain from movement because it hurts, the muscles surrounding the joint weaken, leading to decreased stability, which can amplify pain over time. Clinical guidelines for osteoarthritis, particularly regarding knee pain, consistently advocate for regular physical activity like low-impact aerobics, e.g., walking, and light strengthening exercises, along with Tai Chi or gentle range of motion activities. Walking and similar exercises can enhance pain levels, mobility, balance, and overall quality of life. In fact, programs incorporating gentle movements, like Tai Chi, have demonstrated reductions in knee pain and improvements in physical function and confidence compared to basic education initiatives. Guidelines typically recommend around 150 minutes of moderate-intensity activity weekly for adults. This can be broken into short, 10-minute intervals like brisk walking, plus some form of strengthening. In simple terms, you don't need to engage in intense gym workouts. A daily walk, even lasting 15-20 minutes, is beneficial. Consistency, rather than perfection, is what really matters. A practical approach to start. Enjoy the golden drink daily, if it's safe for you. Walk every day, even if briefly. Integrate a simple mobility routine or Tai Chi style exercises a few times weekly. Monitor your pain and functionality on a weekly basis, e.g., how challenging was it to climb stairs today compared to last week? How stiff were my knees upon waking, rated from 1 to 10? Why is tracking important? You should gather data from your body instead of relying solely on what this influencer claims. Responses vary from person to person. Curcumin significantly aids some, while others observe minimal effects. The same applies to Boswellia. Final pillar, dietary habits. An inflammatory diet characterized by high sugar, ultra-processed snacks, and low fiber and healthy fats can exacerbate joint symptoms for some. Reducing added sugars and processed foods while incorporating omega-3 fats, from sources like fatty fish, flaxseed, is frequently recommended to support lower inflammation and enhance joint health. There isn't a universal, magic anti-joint pain diet that suits everyone. What's crucial is, do you personally notice specific foods causing swelling, stiffness, or discomfort the next day? Document these observations and consult a qualified professional to avoid guesswork. Now, let's consolidate this into an actionable plan. 1. Consume the golden drink daily. Combine water, coconut milk, turmeric, black pepper, and collagen once a day, ensuring safety with your medications. 2. Consider a supervised supplement, such as Boswellia, only after discussing it with a healthcare professional, especially if you're on blood thinners, pregnant, or managing chronic conditions. 3. Engage in daily movement. Walking is a valid form of exercise. Gentle strength training or Tai Chi sessions a few times a week can support joints and diminish pain over time. 4. Decrease your intake of processed foods and sugar, and promote omega-3 consumption. 5. Monitor your progress on a weekly basis, not hourly. A small improvement still counts. This approach offers supportive care. It should not replace medical evaluation, necessary imaging, physical therapy, or medications when required. However, for many individuals, these habits can lower daily joint stress, enhance functionality, and reduce pain's prominence in life. Disclaimer: this content is educational in nature. It is not meant as personal medical advice, nor is it a treatment plan. High doses of turmeric or curcumin combined with black pepper may interact with blood thinners, pose risks for those with gallbladder diseases, and are not necessarily safe during pregnancy. Boswellia is classified as a supplement and not a regulated drug. Its quality can vary, and it may interact with medications. If you experience chronic illness, are on prescription medications, are pregnant, or have unexplained swelling, redness, heat in a joint, a proper medical evaluation is essential. Movement, nutrition, and supportive botanicals can be beneficial, but you deserve an accurate diagnosis.
Why the certain news? From the source to your mind in 1 minute. Verify, then decide. We scan multiple outlets, cross-check the facts, and show you what's reporting and what's opinion. No spin. No hot takes. Just clarity. Quick summaries. Evidence checks. Links to every source so you can confirm for yourself. A clearer picture in less time so you can act on solid ground. Subscribe now, tap the bell. Verify, then decide. Start here.